Medical access here. A new North Carolina law just went into effect today, and it lets pharmacists give customers some forms of birth control without a doctor's prescription. WCNC Charlotte's Jesse Pierre explains how this works and why some say this is a needed change.
One of the repeated lessons of the COVID crisis has been that pharmacists are an incredibly accessible healthcare professional.
And under a new law, North Carolina pharmacists will be able to give customers birth control pills and patches without the need for a doctor's signature. House Bill 96 was signed by Governor Roy Cooper back in August to take effect February 1st.
How does this new law expand access to health care?
And making it something that is easily accessible, like being able to go up to their pharmacist and receive, expands access to this critical piece of reproductive health care, especially for people living in rural areas.
Jillian Riley with Planned Parenthood South Atlantic says you will need to complete an assessment first.
Still do need to speak with a medical professional who is a pharmacist and just complete that questionnaire before they're able to receive oral contraceptives.
Executive Director for the North Carolina Board of Pharmacy, Jay Campbell, says pharmacists are still waiting for final protocols to be put in place by the State Department of Health and Human Services before the services can get underway, which he expects to happen very soon.
We'll set forth the types of screening and any education that a pharmacist needs to have, the screening that a pharmacist needs to do for patient.
This law changes nothing for the most common type of over-the-counter emergency contraception, Plan B. You can still get it without a prescription. This law also expands pharmacists' authority by allowing them to give out other medications, including nicotine replacement therapy, prenatal vitamins, and HIV prevention.
These categories of our medication therapy are ones that there is clearly, again, the General Assembly feels like there's a demonstrated need for folks to have wider access.
Jesse Pierre, WCNC Charlotte.